Good evening, everyone. Thank you all very much for being here with us at AFRICASAN6 and in our session today, which is on discovering appropriate and inclusive service delivery models for urban sanitation. We're excited to have you all with us today. As all of you know, this is a 90-minute session, and we want to spend most of this having an interesting discussion with senior leaders from independent regulators for water and sanitation who are all here with us. So we have an exciting panel discussion with them. And we also have a representative from the Lusaka Water and Sanitation Corporation who's going to be sharing some of the perspectives from the point of view of a utility when we think about service models for urban sanitation. So we have an exciting panel discussion that's coming up. But before we jump into the panel, which I know is something we're all looking forward to, I want to start. My name is Deepa Karthikeyan. I'm part of an organization called Athena Infonomics, and Athena, under the guidance and leadership of CWIS, which is the Regulators Association for Water and Sanitation that several of you know of already, and in collaboration with other organizations like AFRICASAN6 Consult, was brought together 2 years ago to think about a very specific problem of sanitation planning and to think about how we could support and guide the design of more inclusive service models for urban sanitation. The outcome of that is the service assessment and planning platform. And I'd like to kick off this meeting by giving you all a little bit of a context or an overview to what that platform does, and really why we started out, why we were commissioned to do this in the first place, and why we started out and where we are at 2 years down the line in terms of that sort of goal and that platform. And then we will segue into the panel discussion directly from there. I'm just going to share screens. Please let me know. Can you see my screen, Mitra?
Yes, we can.
Excellent. Thank you so much, Vitush. Great. So let me move this. Okay. So what was the problem that at hand when we started thinking about this was that a lot of the plans that were being put together did not focus on service systems or service priorities, but were often framed as primarily technology investments or infrastructure projects only. So weak performance by public service providers, high rates of hardware failure, and low levels of service, despite making large investments in the sanitation sector, was not uncommon. And that was a challenge or a problem. Equity, specifically, who was benefiting from these sanitation investments? And really, where was public expenditure and money going in, and who was accruing the benefits of those investments was not explicitly thought through in a way that is equitable. And equity was often missing or was just an afterthought. And we weren't thinking and talking about how utilities or municipalities can extend services at scale to the marginalized. And a lot of this conversation was just dominated by providing toilets for the poor, but really beyond providing toilet infrastructure, we weren't having good conversations about inclusive service models. And we weren't spending as much time thinking about how these investments were affecting the overall health of the utility, particularly in terms of how taking on one investment was impacting or crowding out the ability of the utility to do other things over a certain time period. And we weren't taking that sort of an enterprise view when thinking about service delivery modeling. And while while investigating and looking at city sanitation planning processes as they existed and looking at these challenges, it became abundantly clear, and this is not new. There has been a fair amount of discussion and conversation, and also some interesting literature on why and how we should recast our approach to focus on providing a lasting service rather than just focusing on rather than thinking about it just from an infrastructure lens. The need for us to think about providing a service, and a service that's equitable and sustainable. And that meant that we needed to start by asking ourselves very different questions that really we weren't asking, or where we didn't have good data. And that led us to this discussion around what are those questions that we should ask ourselves when we start thinking about service planning as against just infrastructure planning. And quite intuitively, it starts with things like, what are the key services that we must strive to achieve in sanitation? What does good look like? Who has access to these services today? How is it different for low-income households versus other categories? How much are these households paying? Who is providing this service today? Is it being provided by the utility or the city government? Or is it provided by the private sector? If yes, are they regulated, or is it the unregulated private sector? What is the cost of providing this service? Is it sustainable? These were the questions that I think we needed to start with, and we needed to find good answers to those questions to shift and really think about building equitable and more sustainable service models. And that also meant we had to go beyond just infrastructure and think more systematically about all of the different levers that are available to us as we think about developing a plan for a city. And this is particularly true in a lot of contexts that are primarily resource constrained or resource starved. The small and medium-sized cities don't necessarily always have the ability to mobilize large amounts of on-source revenue. There is a certain threshold or a constraint in terms of how much they can do in terms of tariffs and the fiscal envelope that is available to them. So in these contexts that are constrained, waiting for infrastructure is the only, or building large, expensive infrastructure is the only panacea to thinking about improving services, just meant that the services were never going to change. So we have to start thinking more creatively about how do you shift service access and service quality, in constraints that are where there are resource challenges. And also, how do we, even when we think about infrastructure, it's important to think about a number of other levers in conjunction with it that allows us to think about whether or not that infrastructure will get us to the service that is desirable. For example, there is an opportunity to think about how I'm going to differentiate on tariff by both my customers as well as my service providers, or what types of tariffs I'm going to charge, which itself can impact the overall health and viability of the utility as an enterprise, and then empower the enterprise to think about service models and infrastructure investments very differently from when they don't have the resources to do so. There is an opportunity to change the market structure by procuring private sector players to deliver services in a certain way, therefore by creating or spurring competition in a way that probably didn't exist. And there is a huge opportunity, either through regulation or through reforms and incentives, or through just technology innovation, to think about how different players will come together and operate and deliver the service in the market. And that's what we call business model innovation. And that in itself is an opportunity. Even just within hardware, rather than just focusing on always incremental or new infrastructure, there is also an opportunity for us to sit back and think about efficiency gains within the existing context, or brownfield improvements, such as densification of existing networks, or other aspects that we often don't fully explore when we think about sanitation plans. there is also a real opportunity to systematically think about, if I had a finite pool of money, where would I put it in? What should the government be subsidizing so that we are able to change the quality and access of service for the most number of people in the most effective way? And how do we think about regulation, which is an incredibly powerful tool in influencing all of these other levers and shaping all of these other levers? And you'll hear more from our panel of regulators shortly about this. I'm not going to spend too much time directly there, but this is just to sort of open up all of the levers through which one can change and shape who gets access to the service. What is the quality of service that is delivered and at what cost and price? And it allows us to think beyond just infra. Now, how do we, all of this is something that is aspirational, it's interesting, and several of you here are probably thinking, yes, we've done this, we know this is valuable, but how do we bring all of this into a single conversation, and how do we allow our decision makers within the public sector context to both collect systematic data and use that information in a way to think about those decisions well? And I think that is what sparked that was the motivation for building the Citywide Inclusive Sanitation Service Assessment and Planning Tool. I'm just going to call it SAP going forward. The SAP platform was really designed as a response to this. We saw a problem, we saw a gap, and we saw the need to support conversations on service delivery models that are more inclusive, and to find a way to do it in where there is agency within the government sector to quickly iterate on different levers and see how it impacts different outcomes, like, for instance, equity, who is benefiting from that service, or financial viability. Are we delivering it in a manner that is sustainable and viable from a resourcing perspective, etc. So that inspired us to develop the service assessment and planning platform. So the service assessment and planning platform it's a web tool. It's available online. You can sign up and use it, and our regulators and utilities have been using it for over a year now, and to shape service models in their context. And again, we'll talk more about that in the panel in a minute. But the platform really for us, was a way of thinking about what data will we collect, how will we analyze and visualize that data so we're able to spark conversations around inclusive service models. It's based on 3 critical principles that all borrow from the thinking on citywide inclusive sanitation. And that is, number 1, we're not going to be able to provide a lasting service that is equitable and safe if it is not formally mandated by the public sector. It can be provided by the private sector, but it has to be formally mandated by the public sector. The service providers must be well-resourced to implement and manage those systems, and they should be held accountable for their performance. And SAP is a way of interrogating whether or not the service models essentially fulfill those principles, because we've seen consistently that if they're not formally mandated, if they're not well-resourced, if there is no systems of holding like accountability mechanisms, we're going to continue to make investments that are not going to perform on shifting service quality and service coverage. We've been incredibly, I think, on behalf of the technical consortium, I think incredibly grateful to a set of visionary public leaders, public sector leaders from the regulators in Kenya, in Zambia, in Tanzania, and in Uganda, who've played such a big role actually in shaping and designing the structure of this platform. This has truly been a co-creation, co-production really process, where at every stage we've had the opportunity to think about what was useful, iterate on it, come back, refine, and make updates and changes. And that is a process we continue to sort of keep at. What does the tool really use in terms of inputs and outputs? And let me start with the outputs first. In terms of outputs today, the tool looks at three key categories. First is equity. Under equity, we look at indicators such as who has service coverage of, for example, safe containment, and how does it change for low-income households versus non-low-income households? Where is the public expenditure going today? The total money that is being spent by the government, either as grants or transfers or direct subsidies, who is benefiting from that money? And how much are households paying today for these services? And does that seem fair and not regressive? On sustainability, we look at a set of standard financial metrics, such as what is the total cost to the government, and are they able to recover that through sustainable, particularly the operational expenses, through revenues, and what is the net profit loss and the net impact on the utility incomes. And we also look at the amount of water that is required to sustain these systems, which we think is a really important metric. On safety, we look at, and I hope you can see my screen, I'm going to just move this. On safety, we look at how much of the waste is, firstly, how many households have access to safe containment? And again, what does that look like for low-income households versus non-low-income households? And how is this managed across the value chain? In terms of data inputs for a platform such as this, we look at three simple categories. The first is, of course, what kind of assets exist today? What is the sort of infrastructure? Is it safe when in sanitation? And we use SFD, the shit flow diagram definitions on safe to qualify this. And we disaggregate that by, again, low-income households and non-low-income households. We look at who is providing the service today. Again, to what extent is the service formally mandated? Or is it just being delivered by the unregulated private sector? And what does it cost? We're looking at costs linked to hardware. We look at how much either households are already paying or willing to pay, and what is the frequency with which they are demanding this asset? What is the CapEx? And again, it's organized by different units. What is the OpEx, and also what is the source of financing? So this is not just this is a financial model where we systematically also build in costs around how we're going to source the resources for this and the costs associated with financing it in a certain format. So if there is a certain portion of debt or equity and grants, we also take into consideration the charges or the costs associated with each of those sources. What we wanted to do in the early demo before we run into the panel was to give you a quick sort of a visual, really, so that we can wrap our minds around now what this animal, what this SAP is all about, with the example of a hypothetical city. So we use the city of Sim. It's just a hypothetical city. Now, this city is located around a set of seasonal rivers. It has moderate water table, and like a lot of mid-sized cities, it's got a crowded center with sort of a bit of a sprawl around. It has about 350,000 people, and it's growing at 5%, with 30% of the households living in low-income, are categorized as low-income households or living in high-density low-income neighborhoods. And there is growing migration, which means that the population growth rate might increase. Where are we in terms of the baseline on the city? About 65%, there are reasonable roads. 55% of the city has piped water access. 25% have sewers. That's about 132 kilometers of network, with about 2% simplified. Today, we don't have good data in the city about really what's happening outside the context of sewers, but taking an educated guess, we think 40% might have line pits or some sort of a septic tank and therefore could potentially be safe, but only 50% in terms of safe containment, but only 50% I think are being serviced. So it's not fully safely managed. Today, the city has a mandate to manage the sewer network and also to manage treatment infrastructure. Recently, they have changed or expanded the mandate or updated the mandate to also include on-site systems, but the city is not doing anything as of today in terms of intervening in the on-site segment. So this is sort of, in this hypothetical city, let's look at a couple of different service model scenarios and let's talk through them in a minute. So the baseline, like we talked about, is about 132 kilometers of sewer. There are 2 wastewater treatment plants. They have FSTPs today, but really haven't intervened or organized in the emptying market yet. And as per their sanitation plan, master plan, they're planning to extend most immediately on their sewer network first. They want to add about 48 kilometers of sewers. And to support that, they also are planning to add 2 additional wastewater treatment plants and believe they also need 1 additional FSTP because they feel the installed capacity currently may not be enough in the future. And they're targeting a concessional loan of about 12 million SIM dollars to support this investment. So this is one scenario, and it's not an uncommon scenario. A lot of this, while it's a hypothetical city, is modeled on what we've seen happen in the real world in terms of service delivery planning. Now, we talked about all of the different levers that one can use when thinking about planning. In a planning context such as this, you see that they're primarily looking at a concessional loan and are largely looking at improving service coverage largely through making specific investments in new infrastructure. Now let's look at a slightly different model, and we can continue to iterate on this. And that is the beauty of this, because it allows us to think and have conversations about where we are and where we want to go to, and keep iterating on the levers so that we feel like we have something that's practical, feasible, and incremental and can help us get there. So let's look at another scenario. This is, again, a scenario that's built based on our experience in some of these cities doing the work, where instead of only investing in sewer networks, we are looking at a model where instead of 48, we're only doing 18 kilometers of additional sewers, and we're adding 1 wastewater treatment plant and 1 FSTP. There is an additional 20 kilometers of simplified sewer as well that's being added in this particular scenario, particularly to in the high density settlements. And we're doing 2 additional things. There is a targeted subsidy in this scenario, particularly to help construct or upgrade unlined individual pits into lined pits. And that's specifically targeted at the low income households and neighborhoods. And a portion of that is also targeted at upgrading or supporting with septic tank upgradation wherever those exist. Additionally, the city government, the utility is investing in a set of 20 mechanical desarging units, which they, in this particular scenario, have purchased and leased for free to serve as to serve as transfer trucks, really, again, to really help increase the proportion of waste that gets safely disposed after it is emptied. And the way that would work is the manual operators will be incentivized again. So there is again another sort of a subsidy that goes in through some sort of a tipping fee to deposit their waste at a designated point within the neighborhoods where they are emptying. And these mechanical desludging units that are purchased by the utility will then actually help transport that waste to a designated point. So this is a slightly different investment or a different scenario or a service model scenario. And in a context like this, you see we're playing with a lot more levers. And we're thinking firstly, we're thinking about a subsidy design that's more targeted. both at the emptying segment of the value chain and also more targeted at the poor. In addition to thinking about diversifying the portfolio of hardware assets between sewers, simplified sewers, and on-site system upgrades. And we also have an element of monitoring and control that's been introduced into emptying that did not exist before this. Now, how will we visualize the outcomes of such a service model? And I will show you in a minute what SAP really does. So when we compare service models, I'm just keeping a tab of time, 2 minutes, and we'll jump into the panel discussion. But when we compare service models, and I'll just walk you through this. So on the leftmost corner, what we do is you see there are some notes around what is being planned or considered, and we've talked about that in our previous slides. And we start with the key, basically breaking down the service coverage environment into 4 categories, which is sewer, non-conventional sewers, safe containment, and unsafe containment. The service coverage data, the bar graphs that you see here, as you can see, the city has 30% low income and 70% non-low income. The red bar is the non-low income households, while the blue is the low income households. In the most simplistic sense, the goal of any sanitation plan is to move households from this big bar that you see right at the bottom, which is unsafe containment, to one of these 3 categories. So the goal is really, how can you bring this down to 0? As you can see in the baseline scenario, most of the households are concentrated in the unsafe containment section. And in fact, a bulk of it is low income. And only 42% of the total waste is safely managed in this scenario. It's also important to see what percentage of what is happening today is formally mandated or delivered versus by the public sector. And you see, and this is again not uncommon, that the role of the public sector today is largely restricted to the sewer and the sewer network, particularly the emptying, transport, and treatment component of the sewer network. And again, just the treatment component of the non-sewered network or the simplified sewers as well. This is very limited public sector intervention, really, except for a very small role in the simplified sewers in the rest of the market today. And in terms of public expenditure, you see that a bulk of the public expenditure today is focused or targeted on sewers, which is largely today concentrated on non-low income households, not the low income households, which means today, as is in the current service model or in the current baseline scenario, a bulk of the government expenditure or investment, the benefits of it are largely accruing to the non-low income households. And only 42% of the waste is safely managed. Now, let's look at the first scenario where we're making just a set of infrastructure investments in expanding the sewer network without changing the market structure in terms of public sector mandates. And if you see, we are shifting safe coverage. We're going from 42% in the baseline scenario to 52% in this particular scenario. But what you notice is that 10% of the households who've moved from unsafe to sewers are largely concentrated again on the non-low income. And your public expenditure is ballooned. You're spending a lot more, almost $20 million more, to support that shift of 10% of the households from unsafe to sewers. And there is no impact or change in the market structure. Now, let's look at, and I can walk you through the $38 million expenditure also includes the operational deficits one is accumulating to sustain that sewer infrastructure, by the way. Now let's look at if we just even made a few tweaks on the service model and looked at a slightly different scenario that we talked about earlier, where we are subsidizing on-site system upgrades. There is more public investment in the emptying market. That did not happen in the second scenario, and that is being formally mandated and with some accountability, particularly on MDU operations, to the public sector. What we're seeing is we're able to move from 42% to 71%. And this bar, you see, on unsafe containment is smaller, and a big shift, the 29% change that you've seen in this particular context from the unsafe containment is better distributed, and 50% of that, 17% approximately, are targeted exclusively at poor or low-income households. So there is, as against the first scenario, where the impact on the poor is practically non-existent, in this particular scenario, we see we're able to be more targeted through an intelligent subsidy design, through greater technology diversification, and through greater intervention in the market structure that is formally mandated. So you can see here, we go from being entirely unregulated, which is what U stands for, to a combination of unregulated and regulated. We're still spending the most money incrementally in terms of sewer networks, but the investments itself are more diversified. What are some of the other metrics that are interesting and valuable for us to look at is how much are households now spending, right? In all of these different scenarios, we have, okay, first, what's important and interesting to note here is that you see that the households that today have access to safe containment are already paying a lot more than households that are connected to sewer networks, which means it's either a proxy for willingness to pay, because there is already the households that low income and non-low income that are comparable to the ones that do have access to the sewer networks are already paying a lot more to the unregulated private sector market. So there is an opportunity for either a conversation around price control in the context of safe containment or tariff increases in the context of sewers. But in this particular scenario, none of the interventions have a direct impact on household or what households pay. So as you see, the data on household annual expenditure pretty much more or less stays the same throughout, which also shows that there is an opportunity. So if you do want to intervene on that metric and change that, there is an opportunity to do so. But in our investment scenarios, we're not intervening on, or none of the interventions are either changing the amount of direct competition to lower prices, for example, on emptying, or providing any direct additional subsidies that has a substantial impact in terms of overall household cost. It's just a small marginal change, but it's not substantial. In terms of cost coverage, you see that in all three scenarios, we still have an operating deficit, which means there is a need for us to systematically review tariffs and look at revenues and think about how to structure and improve that. But you do see that the operating losses are lower in scenario 3 as against scenario 2, and there is still an opportunity to improve that. Water is a really important component and something that we should have better conversations about. The water footprint overall of the third system is lower with opportunities for optimization. And we also see that the extent of waste that gets safely managed or is likely to be safely managed in the third scenario is also much higher than in the second scenario, at a lower operating deficit and at a lower overall government expenditure. I know this is a lot to take in, but this is really the goal, though, of SAP. And it's, of course, and this is just, and the goal, the reason I wanted to provide a quick snapshot was just to spark our imaginations and sort of get us to wrap our minds around the sorts of data that might be interesting to look at as we're comparing and thinking about service models and what inclusive service models are. This is a platform that's available for those of you interested. It's at cwisplanning.com. You can set up an account. We can help you set up an account and you can log in and play with it. It's a pretty hopefully a user-friendly platform, and we're always open to feedback on how to make it better. Without sort of further ado, I want to jump in and now use the opportunity. And I know there are probably questions coming in, and I have colleagues who will help with sort of facilitating the chat function. Mitra and Bitush, feel free to just keep adding into our... Richard, do you want to lead first, and then we could just go around and have everyone? Yeah, please go ahead, Richard.
Thank you. Thank you, Diba, for that very elaborate presentation. And thank you for the introductions. Like you rightfully said, my name is Richard Chiruyot. I work with WASREB. WASREB is the regulator for water services in Kenya. In Kenya, we basically had the reforms now for the last almost getting to 20 years. And WASREB really is a creation of that reform process. And really speaking to your question and looking at where we've come from with this, I think to start me off is really to give a context to where we are with respect to sanitation services in Kenya. If we look at what we put out annually in terms of our sector report, basically access to sanitation in Kenya is fairly still very low. With the challenge being that, we have focused mainly on off-grid sanitation, which is really seaward sanitation. And currently access to that is less than 15% if you look at most of the urban settings. and so really with what we have set for ourselves in terms of the national targets, what we have as commitments to the SDGs, there was need definitely to rethink the approach to addressing the sanitation challenge. And that's why, like you're saying, if you look at this session, is really discovering different service models to ensure that we deliver on the sanitation targets. And so in our country, really, we started with looking at the policy. So we had to, like I said, the policy initially really focused mainly on seaward sanitation. And what we've done basically is enacted a policy, a sanitation management policy, which policy basically also, one of the overarching principles really is to focus on both seaward and non-seaward sanitation. So that's what we've done in terms of really addressing the policy challenge. Because Diba, like you've said, it's really critical that we clearly define, as we look at sanitation issues of mandates, who is responsible for delivering that service. How are these actors that are responsible for this delivery of this service accountable to the people that benefit from this service? And of course, how would we address the whole issue around the financing and planning for this service? So I think the first step that we did is, by having that policy in place, it does really set out what the country looks at in terms of addressing the sanitation challenge. And that has basically clarified roles for the different actors. The governance framework in Kenya is that we have one national government, but also in the last about 11 years, we did have a change in our governance framework where we have devolved units that we call county governments. We have 47 of this, and the duty really to deliver service is on the county governments. So the policy does set out clearly what the different actors would really be required to do. But again, that governance change in the country has brought with it a lot of benefits. But on the other side, courtesy of rural-urban migration, because the 47 county governments basically have county headquarters. And what we have seen in the last 10 years is that there is a shift towards these urban centers by a majority of the citizens. And so that again places a bigger demand on the actors to really ensure that they improve access to sanitation services. So it's really for us to look at that as an opportunity or a market for us to provide services. But again, if we look at where we stand with respect to really the utilities that we have established. We can be, for Kenya, we can actually say for all the urban centers, we have established really entities to provide water services, which are units or which are vehicles really for service delivery on behalf of the county governments. But again, the challenge is that, these units have mainly focused on seaward sanitation, with very little focus on non-seaward sanitation. And this has basically been left to the private sector or in the informal service providers. So the policy really does clearly outline now the mandate of the water service providers to include the issues of non-seaward sanitation. And what we have done basically as a regulator for water services is that as a license requirement, we do require that utilities do exactly say what they are doing with respect to access to sanitation services, and really encouraged or given incentives to the utilities, those ones that get involved in non-seaward sanitation.
I think we lost Richard. Can you hear us?
Like I mentioned, one of the key mandates given to regulators is really track implementation of policy. So the policy has clearly said what we are looking at, and WASRE being a regulator now for water services, our main goal is track what the different actors are doing with respect to delivering on the policy aspirations. So on an annual basis, we have started by putting out there or tracking sector performance with respect to sanitation. Initially, the focus was on non-seaward, on seaward sanitation, but since the last 3 years, we have included access levels in the country in terms of non-seaward sanitation. This is really for us to be able to raise the profile of non-seaward sanitation in the country. Like I said, we have also expanded the mandate of the water service providers. We initially used to call them water and sewerage companies. So majority of them, and Kenya has a very high number of these utilities. Currently, we have about 91, and we're really pushing them to shift their mandates to include non-sewer sanitation. And so you will actually find that a majority of the utilities have now changed their names from not just sewerage companies, but water and sanitation companies. This is just to ensure that they don't just focus on addressing just the sewerage aspect. Diba, as you presented, of course, it was very clear that really to be able to make use of this tool, and we are happy that we were part of the development process of the tool, is really the need for the actors, mainly the utilities, to have the right data. And as a regulator, we really tried to support the utilities be able to disaggregate cost data in terms of water and sewerage services. I think in a number of jurisdictions, and Kenya included, where we come from previously is that we have looked at the cost of sewerage or sanitation as a proportion of the cost of water. But really, is that really the case? No, but I think, so what we have done is required the water service providers to have a disaggregation of the cost components, just to be sure what is it really that is costing these utilities to be able to provide that service. And of course, that costing will then be carried forward in the tariff setting process. So because one of the key mandates of WASREB is really to determine the tariffs for provision of water and sewerage services, then with that cost disaggregation between water and sanitation services, then WASREB is then able to approve tariffs for the water service providers on the basis of the different services that are giving, and really be able to determine the cost of providing sanitation services. I can say definitely that we have really gotten to a level that we have very good confidence with the data that we have, but this is a process that we have to go through. And I think for me, what is very important is the fact that we have started the journey. We appreciate that where we come from, the context is very different, but I think the SAP tool does accord us an opportunity to be able to really look at what is really what goes into the delivery of sanitation services in terms of cost, in terms of technologies, and really have an evidence-based let me say, approach to implementation of different sanitation interventions. So I think for us, that was really the interest. And we, as a country, of course, we were part of the pilot, but we really want to now scale this up to a number of utilities, and also now be able to use this in a number of decisions that we're involved in, and one of them being, of course, the tariff setting process. So I think I will leave it there, Diba, in terms of what really motivated us, and I think we can continue the discussions. Thank you very much.
Yeah, thanks a ton, Richard. No, thank you. And I think it's fascinating, right? Because I think you touched upon all those different elements we talked about. You touched upon how you're changing mandates, how you're thinking of incentives to support that change in mandate, and also how you're holding them accountable through your annual reports and the expanded set of service KPIs on it. And, you know, and this particular aspect around how to re-engineer the financial management is like, how do you go back and change how you're collecting cost to serve information and disaggregating that by sort of really different business lines and asset categories is incredibly exciting, actually. And of course, I know this is a huge complex, because a lot of this thinking is still technically very difficult to operationalize, because we're still learning as a sector about how to do that well, I think. And you know, we have a lot more institutional wisdom and knowledge and experience and capacities with designing and implementing CWIS, but trying to think outside of that framing is going to require a lot more capacity building and hand-holding and figuring out how to operationalize that. And maybe we'll circle back to how, and maybe, you know, it'll also be great to see if, you know, we have panelists who can touch upon that. But I want to contrast the experience of WASREB with Engineer Christopher with WURD, right? The Water Utility and Regulatory Department at the Ministry of Water and Environment, where I think I've been in awe of how the vision you've set for WURD personally, and every time I hear you speak, Engineer Christopher, it just reinforces my faith in a lot of the things that we're doing. But I do want to contrast the fact that WURD is relatively new and is trying to do a lot of the things that maybe WASREB just has had more time to do. So maybe it'll be great to hear about where you are in Uganda, but there's also an opportunity to learn from other regulators that have been at this process for longer. But it'll be great to sort of hear your experiences or what you're doing in Uganda within the ministry, and to shape the way you're delivering sanitation services.
Okay, thank you very much, and good afternoon, Ugandan time, and in the different areas. Christopher Tumsime, Commissioner of Utility Regulation in Uganda, in the Ministry of Water and Environment. This is a place where we have got, Uganda is a country with 41 million people, and 27% of this number lives in urban areas. And I'll have to give you the reason why I am keen to talk about the 27% who live in the rural area, in urban areas. The access to improved sanitation is close to 50%, 18% in rural areas. But when we talk about safely managed sanitation, the figure comes down to about 39 to 40%, and much less also in the rural areas. Safely managed, I don't want to go into the details of what we describe as safely managed sanitation and the like. We still have also cases of open defecation here and there, and we try to work out the open defecation free, declaring villages open defecation free. We still have those cases when it comes to sanitation. We have different modes of sanitation in Uganda, seaward, mainly in the urban areas, and the responsibility of seaward sanitation is the National Water and Sewage Corporation, covering almost all the cities, city councils in the country. But we also have non-seaward sanitation. Non-seaward sanitation meaning these are the septic tanks, drop and store, the pit latrines, the flush systems, and the like. So we have quite a big range of sanitation that we're talking about. And when we talk about the improvement of sanitation and we set targets, when we set the target, we don't only look at seaward sanitation, we also look at the non-seaward sanitation. So the issue here is that the scattered nature of the responsibilities, National Water and Sewage Corporation, looking at urban sanitation, seaward sanitation in the city, but we also have cases of non-seaward sanitation, and this is now when we are talking about those areas that are responsible for the urban local councils, the urban local governments, and other areas by the Ministry of Health, health inspectors, and the like. But when we talk about sanitation improvement, then we need to talk about all this in totality. And in our situation, what we have done is, first of all, the data management and data availability is a bit weak in the country. This is when we talk about even the sewage sanitation in the city and the non-sewage sanitation. When it comes to the non-sewage sanitation, drop and store, the containment structures and the like. So the current tools that we have been using, we are using the utility performance and management information system. It is extremely a little bit low, a bit weak on sanitation planning. But we also had started town sanitation planning, which is a bit better improved, but we still have challenges, especially when we talk about targeting, and those ones maybe for another time we can talk about that. We needed to adopt a holistic approach into monitoring and reporting, because when we talk about sanitation improvement, we needed a tool that gives us an opportunity to look not only at the containment structures or sewage sanitation structures, but quite a whole process, including those who are responsible for transporting the sanitation deposits, that is the haulage of septage into the treatment plants. We also talk about resource mobilization. When we talk about resource mobilization and planning, it has been a bit of a challenge. When we talk about improve the city sanitation to 44%, for example, where do we target? Where do we target? Do we target the containment structures? Do we target the sewage sanitation? Do we target the drop and store? So we had to look at quite a number of those areas that can look at improvement of sanitation. The stakeholder mapping, when we talk about the mapping, we needed also to get a tool or some way that can get us to identify those areas which need to be specifically targeted in terms of improvement of sanitation. The limited demand for sanitation, in the country, we have a challenge of leaving the sanitation improvement to an individual, except the sewage sanitation. That is where we use the National Water and Sewage Corporation. But when we talk about the non-sewage sanitation, now that one is left to an individual. So there is a bit of a problem. So this is where we are starting from. This is where we are looking at SAP, the SAP tool, which we have been using, and trying to looking at the sanitation in a holistic way, look at the different technologies, look at the different approaches that we can use, look at where can we target if we indicate that the money is that were needed for improvement of sanitation. This is where SAP tool has helped us. We have started with the city of Kampala. It has been so great. We used the other tools, but when we use the SAP tool, there has been a bit of change. And when we see that the target, where can we target the sanitation infrastructure? When we talk about improvement, we want to improve sanitation in the city to 40%. But do we now look at how much money do we put in? Whom do we target? What is the cost? What are the costs involved? Do we look at subsidies? Where do we target the subsidies? So the SAP tool has helped us looking into quite all of these issues. That is what I can mention for the meantime. From your question, Deepa, please.
Yeah, no, thank you so much, Engineer Christopher. This is, I know, and I think Kampala has also been really fascinating. And for those of you who haven't seen the Kampala strategic plan, I would encourage you to look at it, because I think we really enjoyed modeling that and thinking about the data from that plan, because it's one of those plans that is really trying to, is also tried to look at all of these different levers in terms of how to shift goals. And I think some of what Engineer Chris just mentioned about, and particularly has a pretty interesting approach to emptying subsidies. And I would encourage you to look at it. They're trying to replicate some of the successes that the Pitvidura-Pitwak model has seen on the technology side in Kigali, Rwanda, but replicating the technology successes from there, but then designing an innovative and interesting subsidy design around emptying. And I would encourage you to take a look at it. And we can also, add that link into the Pathable chat for those of you, who are interested to come back and look at that design. But thank you, Engineer Chris. I think we're also excited at the way in which in Uganda we're planning next steps, both in terms of systematic capacity building as well as investments in data systems to fill some of these gaps. And we can circle back and hopefully we'll have time to talk about some of those elements as well. I want to now turn to Lusaka, where we have Chola from the regulator and also Muviche from the Water and Sanitation Corporation. So one of the things we did during this process was to work. I think the primary lead agency has always been the national regulators for us. And we worked with them to pilot this in one city context. In Uganda, it was Kampala. In Kenya, it was Nakuru. And in Zambia, it was Lusaka. And we're lucky to, in the context of Zambia, also have a representative from the utility. It'll be great, Chola and Muviche. Maybe Chola, you could go first, and then Muviche, you could supplement that from a utilities perspective, both sort of what you're doing, for instance, in your context, what your experiences were, also both in terms of just the motivation to want to get involved in a process like SAP. So maybe Chola, feel free, maybe you could go first, and then it'll be great to hear from you, Muviche.
Okay, thank you so much, Deepa. And I think that, it's been great actually working with you and your colleagues on this particular tool. From the Zambian context, I want to begin from the point of view of how we got to, regulate on-site sanitation. So as people might be aware, Zambia, the Zambian regulator called NWASCO is one of those regulators that has been around for a very long time. I think we are just about 21 years old in regulation. So we've been there quite a while. But in terms of regulating on-site sanitation, I think this is a fairly new concept. Just like any other regulator, in the continent, I think we are just getting our hands into this. And what motivated us really was that, issues of service delivery, particularly for sanitation, have been lagging behind for quite a long time. And for us as a regulator, that was a source of concern that, in as much as we were seemingly doing well, in the area of water supply, sanitation was really lagging behind. And when we look at all these plans that we have at national level, as well as the international agreements that we have, signed up for, we seemingly were not moving as much as we would have loved to. So when we zeroed into that, we realized that the bottleneck there was that the service delivery sort of mechanism was limited. It was focused on issues to do with sewerage systems. And at first, we thought that if we push investments in this area, it was going to help. So we started to lobby for partners to really invest in sanitation. And what we saw, obviously, as you can imagine, was that partners came on board, and yes, they were investing in sewerage systems. So they were coming in to construct these very huge sewerage treatment plants, and they would do that at a very high cost. It was time consuming to have them completed and so on. But still, even with those investments, and I can say here that in Zambia, we have had quite some investments in these sewerage systems, we didn't see the movement that we anticipated to see in terms of coverage. And that is the bottom line of any regulator. We want to see service improvements. We want to see issues to do with safety. We want to see issues to do with affordability. So with that, then we refocused and said, I think let's look at other types of sanitation. And that's when now the issue of on-site sanitation came into the fore. So in discussing that, as a regulator, we went on and developed, a framework for regulation and service provision on-site sanitation. And in that framework, I think primarily what we were addressing were issues of governance structures. How do we arrange, the governance structures around on-site sanitation and fecal sludge management? Then we also articulated enforcement mechanisms, because we thought that these were important. If we're going to delve into this particular subsector, we needed to be very clear on what sort of enforcement mechanisms needed to be put in place. And then finally, in these frameworks, we had to articulate the service delivery models. So what sort of models, are we looking at if we want to talk about on-site sanitation and fecal sludge management? So after articulating, all these issues, we went now into details to say that, can we begin now to implement these frameworks? And in implementing the frameworks, I think one of the first things that we did was to extend the mandate, for the service providers. So like you rightly put it, Lusaka Water and Sanitation Company was initially called Lusaka Water and Storage Company, but with the extended mandate, we now renamed them from the license point of view. And we focused on the service providers because for the regulator, the mandate was already given in the Water Supply and Sanitation Act. It's just that we didn't have, mechanisms to actually work in this subsector, but we already had the mandate right from the time that the regulator was created. The other thing that we delved into was to see how we develop standards, regulations and legal instruments to be able to regulate and also to provide an enabling environment for service delivery of on-site sanitation and fecal sludge management. So in so doing, I think we've got a couple of, statutory instruments. We have standards that we've developed. We also, have developed what we are calling permitting conditions, because the service delivery model that we are looking at in on-site sanitation allows for private sector participation or even community, led organizations to participate. So we needed permitting conditions for those that would participate in this. Then going on, we actually had to articulate the structures, for both the utilities and the regulator. What sort of structures are relevant for us to be able to, delve into on-site sanitation and fecal sludge management? So we did that, and we also looked at issues of data collection, which actually, is one of the key aspects that the SAP 2 brings in, because it actually forces people to go and collect data to the finer details that are required. So in our case, in dealing with the issue of data, we had to zero in on assisting utilities to do the GIS mapping because they need to know what's on the ground. And this, as you mentioned, Deepa, is not something that you can just sit back and begin to give instructions for utilities to do. I think it's something complex, it's something demanding, so regulators need to also get involved in this. So we are supporting utilities to do the GIS mapping. We are also trying to modify our NOASCO information system to create room for data related to on-site sanitation and fecal sludge management. And also we are supporting the ministry responsible for water and sanitation to develop an integrated information management system that will also have our data around on-site sanitation and fecal sludge management. Then the issue of reporting also, as a regulator, we produce annually a report which we call the sector performance report. So again, in there we had to deliberately include indicators to do with on-site sanitation and fecal sludge management. And in looking at that, I think what is guiding us is the ladders that have been defined by JMP. So we want to really emphasize that on-site sanitation is also an acceptable form of service provision, and that it is a much cheaper and I think easier way to invest in for most of these utilities that are behind in sanitation service provision. Then the other issue, Deepa, that I would want to mention is something that you touched on. It's the issue of capacity development. So I think from the point of view of both regulators and service providers, there is need for capacity to be built. And as NOASCO, I think we've started to look at that. So we are trying to build our own capacity in that area, but at the same time, we are supporting utilities to also build capacity. And we are looking at sanitation across the service chain and focusing on specific aspects and assisting. So for example, we are supporting training for pit emptiers and sanitary workers so that utilities are equipped to get into this area. In terms of incentives, I think we've had this sanitation surcharge as a regulator, which we've been applying, but in the past, it's been focusing on sewage systems. But in shifting the mandate to broaden it to include OSS and FSM, we've also, re-strategized on this sanitation surcharge. So now utilities are allowed to use part of these funds that they collect from the surcharge to invest in on-site sanitation, services. So now looking at all this, I think from our point of view, what we realized actually was that the issue of investment is not so much of the problem in sanitation. I think it's something to do with how prudent have we been in these investments? Because when we look at the huge sums of money that have gone into the sector so far, Lusaka Water, I'm sure they'll come in to talk about how they've had these huge investments in treatment facilities. But when you look at what is going to come out in terms of how many people will be saved and so on, you realize that it's just a fraction of the population. And we'll still get back to the discussion of saying, how do we extend, service provision? So I think for us as a regulator, our preoccupation has been that, can we see the best way of extending services at an affordable rate and also in a sustainable manner? And when we talk of sustainable, I think therein, lies the issue of safety as well, because sustainable is not only for the institutions that are providing the service, but also for the environment as a whole. So basically, I think to begin with, Deepa, that is what I can say. I'll allow Mwiche also to come in from the service delivery point of view. Thank you.
Thanks, Atanchola. Mwiche, what's it been like to be on the other side, to be the utility that is being regulated, to do all of it?
Thank you very much, Deepa, and thank you everyone for listening in. I'll just go straight to the point and just articulate most of the things that we are doing as Lusaka. We are a service provider, like it has been mentioned. Initially, we were focusing more on sewerage provision, but now, as of October 2019, when our licenses were changed so that we could also focus on on-site sanitation, we are also mandated to do so. So furthermore, Lusaka Water Supply and Sanitation has been implementing a Lusaka Sanitation program, and component 2 of it actually has a lot on on-site sanitation. So with that, we had support from four financiers. We had the World Bank, Africa Development Bank, EIB, and KfW. So we also had further additional support from the Bill and Melinda Gates Foundation to help us with the soft issues. And that's how we got ourselves involved actually in the SAP tool that we are actually discussing. So we are guided by a lot of policies that Chola had also alluded to. We have the National Water and Sanitation Policy, and we also have the Public Health Act, which is a bylaw, because we need that, which is also helping us to ensure that we compel everyone in these areas to actually have safely managed sanitation. So in terms of the business models that we are actually using, we have aligned them to the Lusaka Sanitation Master Plan. And also we have an on-site sanitation strategy and also our strategic plan of 2018 and 2022. And these documents actually, they speak at how are we going to actually ensure that we are in the service chain, we are also involved in the containment, emptying, transportation and treatment and disposal. So the strategy is in place. It also looks at the short term, long term, and also the medium term. So during the project implementation, we've had subsidies also just to help us actually create demand, because previously we had on-site sanitation facilities which were not emptyable. So it was a situation where those traditional toilets where you just use them, when they're full, you bury, you dig on another pit. So we are looking to see how we can upgrade the existing on-site sanitation facilities, the traditional ones, and also construct the emptyable toilets, because we need the slide for our business that we are actually embarking on. So during the process, we noticed that we had actually challenges with the data for us to populate in the tool at the time when we actually started. So we had a lot of challenges because we were not even able to tell how many on-site sanitation facilities Lusaka province, Lusaka city had, as well as not knowing even the number of septic tanks that are there. So it actually, when we started, we were involved in the SAP tool, it actually gave us actually an eye-opener to ensure that we needed to actually collect this data. So that's how come we also were able to conduct the sanitation mapping, which was concluded 2 months ago. And right now we have enough data, which we are trying actually to align even to the NOASCO information system. So that way we'll be able to have the proper scenarios when we put in our SAP tool. We also have another system, a monitoring and evaluation system, which was also done under the project. It has indicators which have been aligned with the regulations. So we are able to monitor how we are actually moving on the sanitation ladder with respect to scaling up on sanitation, with issues of safety and issues of equity and also sustainability. We also want to show, of course, we've had a lot of huge investment in terms of sanitation, storage facilities being constructed and so on. But we have not seen a lot of movement in terms of the sanitation coverage, because 70% of the population reside in the low-income areas. And those are the areas where we find it very difficult to have sewer connections or even sewer pipes in those areas. So I think it is good that we actually were motivated to actually use the tool and to be the first people to actually be part of the process, because from there we were able to also see how we could offer other solutions to these low-income areas. Not only low-income areas, even in the non-low-income areas, we have areas where we are able to provide storage connections. So we are able to see what kind of options we can offer for these, so that we have at least some sludge that is actually treated at the end of the day. So what also other things that the platform has helped us to do, we have used the platform for more than a year now, and it has actually, like I said, it pointed us to the gaps that we actually needed to work on, and we were able to put in our questionnaire. We were able to feed the questions that we needed for us to get the profiles for the sanitation, and that sanitation mapping. And it also helps us to also do some justifications when we're applying for the tariffs, which we applied for 2022 to 2024, because we're able to use this tool to help us actually project the investment that we needed for both options, either the SWOT and the non-SWOT projects. We also privileged actually to also project how many emptyable, like on the technologies of the toilet that we needed to offer. When we were also trying to revamp the sanitation surcharge, we used the tool actually to help us to do that. We also used it actually to do the proposals, because right now we are in the process of reviewing our strategic plan, which comes to an end next year. So we use the tool actually to do some proposals for us, some projections for investment that we may need in the next planning horizon, as well as also update the Lusaka master plan. Because at the time that the Lusaka sanitation master plan was developed, I think the issues of on-site sanitation were not in the picture, because we were only looking at a heavily sewered connection, where we were proposing to have more of these wastewater treatment facilities. But the beneficiaries, if you look at that, it's just a small population of people that would benefit from that, because of the issues of the space, and the city has not been planned well in most African countries, not only Zambia, but that's what is happening in Lusaka right now. I think the other thing also, it is also another way going forward, we may be using the sanitation tool to strengthen advocacy, and also when we are lobbying for investment for sanitation, because you need to show your investors that this is what we want to do, and you need to be very precise of what you're going to do and what are the benefits that you're going to get out of that. So from a sector point of view, I think this tool is a good tool that would actually ensure that the sanitation profile in the country is well organized. And would also propose that it is also something that would also help us to actually decide whether we want the market structures that we want to work with, whether it's a regulated or an open market. But what we have noticed, because we are working with the private operators right now as Lusaka, we have partnered with them in the service chain. So we've noticed that in the private sector, they are the people that are really making money out of this business. But the utility is just there in the containment stage. And what we are doing under the project, we are also trying to see how we can offer incentives to the private operators. We have also bought some trucks to help them in the emptying business, which we are hoping that after 5 years, they'll be able to buy those trucks. And we are also, we have some subsidies also for the construction of these toilets and also emptying services. So we are hoping that next year, after the project comes to an end, the sanitation surcharge will take over to also continue with the toilets that have been constructed. So far, we have constructed about 5,200 sanitation facilities for Lusaka. So the people that can be involved to use the tool, we are looking at the government ministries, the local authorities for planning, and also service provider, not only utilities. There are also these private service providers, apart from the utilities, the community-based organization, and also regulators will be actually benefit from using this tool. I think this is where I end my discussion, unless there are other questions that I may need to clarify. Thank you.
Thank you so much, Muviche. Thanks a ton. And I think No, this is fascinating. And I think there are some really interesting questions. And it's funny, it's almost like we're just starting, really, just starting to get into the interesting bits. And we have 5 minutes left. But I really want to take up this one question that's come up, I think, really around how do we, all of you've taken such bold steps in terms of both shifting mandates. How complicated was that process? Because you're not starting from a clean slate. Often you're taking mandates away from possibly one organization and shifting. And I think, is it Beverly who's pointed out correctly that maybe right now it's the Ministry of Health or it's the city government that's providing services in the non-CWIS sanitation context. What was that process like in terms of shifting mandates and deciding roles and responsibilities? And was that something that the regulator did? You set the protocols and then everybody had to follow, or was it a participatory process? I mean, any reflections on how that process of shaping mandates was like would be great. I think anybody feel free. Engineer Chris, I see that you went off mute first. So if you want to react to that question, please go ahead.
Okay, thank you very much. Always I was laughing because adapting to change is something that is not human. Yeah? The first one, we worked with the city authority in Kampala. And as I indicated that what the benefit we had seen in the SAP tool was to provide a holistic approach, not only looking at the infrastructure of the toilet, but the entire chain of a self-managed sanitation system. So we had, we interestingly had one project called Water for People. Water for People, the NGO, they are doing some things to do with the septage. Can we garping, and these are targeting the smaller communities. But when we come to the city authority and we say we need to see how we can improve sanitation, the biggest challenge that we got was data. We looked at where are these facilities, where is it the cost of garping, the transportation of septage, correction, the assignment of roles and responsibilities in the whole chain, the treatment, where do we have to treat this infrastructure, where do we do operational costs. So there was quite a lot, And when we were asking for the data from the city authority, we started by them saying that, no, this is not an examination. No, this is not a research project. We said, no, it's not a research project. But in order to do sanitation planning, assessment and planning, we need to look at all these different components of the sanitation chain. And towards the end, I think were the best, if I had a representative from the city authority in Kampala, will tell you that the SAP tool actually, I wish that we could even have something like that more, because to pick all this information was not a straightforward thing. Some data we didn't have, some we thought it was not necessary, but at the end of it all, we have seen that all this is necessary. And looking forward, it is also the same infrastructure, the same data that we are now interesting other city authorities in the country, that we need to get this data in order to look at sanitation in a holistic way, and not only looking at the disposal, not only looking at collection, but the entire value chain, including the costing, including the targeting, so that if we set a target and we say, what is our basic sanitation coverage here now in this city, it is at this point, and we want to move to this point, where can we best target Do we go for the seaward sanitation? Do we go for non-seaward sanitation and non-seaward sanitation? Which components of those non-seaward sanitation activities? And if it is maybe to add on those costs of subsidy, whom do we target in order to get to the target, to the outcome that we want? So this is something that has been really not the conventional way, and we thought that some of this data was not, but it has told us, and it has helped us to understand that we need a lot of information and basic information in order to plan for sanitation improvement in the cities.
Yeah, no, thank you so much, Engineer Chris. And I think that's such a valuable perspective. But, you know, and I think, and maybe Chola can also add, how complicated is it though to change mandates or expand mandates, particularly when you're not operating on a clean slate? Chola, do you want to come in and maybe reflect on that?
Yes, Deepa. First of all, I will be very honest that it is not easy. It's quite complicated in that people don't like responsibilities to be taken away from them, particularly if you are talking about government institutions. So it's not something that one would think is going to happen overnight. It's quite a complex issue, and it's very sensitive as well. But the way to go about it is that you need to start from a legal framework point of view. And in our case, what we did was we had to do a diagnostic of all the different roles and responsibilities from a legal point of view. So we list out the entire service chain, and we say who has been given the responsibility to attend to this particular aspect in the service chain from a legal point of view. Because there are some institutions, as you do that, you realize that some institutions may be carrying out that, but it is not really legally mandated to them. They just do it, maybe they are filling up a gap. So who is legally responsible? Then when you establish who is legally responsible, as you do that process, you are also identifying the gaps and the overlaps. So then where there are overlaps, you need to then come on a round table and streamline who is better placed to do this so that we hive it off the other institution. And where there are gaps, you then say again, who is better placed to actually fill this gap? So in our case, it took quite a number of interactions with the different stakeholders, but at the end of the day, we were able to highlight, and the framework that I referred to that we developed actually has those details. So it will say, this is the value chain, this is the people that are players in each of these, this is where the gap is, and this is how we have streamlined it now. And this institution focuses on this and so on. And when you talk of sanitation, I've seen Beverly's comment. Yes, there are many stakeholders that are involved. So you need to streamline. It doesn't mean that a regulator must handle everything. NOASCO doesn't handle all the aspects of regulation in the entire service chain. We have other regulators like the Environmental Management Authority that comes in at a certain point. So it's a matter of streamlining based on what is legally provided, and also trying to see how you cover the gaps, and also, you know, try to clear off the overlaps. So the process itself has to be done in a very, very strict way of consultation and open-mindedness. But I must say that it is not a very easy process to undertake. You need to be alive to change. You need to be willing to change, because in some instances you will have to drop a mandate which you thought was yours, and you've been doing it and you thought you were doing it very well, but then somebody else says, look, this is actually not your mandate. So I think that is what I can say, Deepa.
No, thanks a ton, Chola. And now you can, I mean, for those of you who are joining us, you see why we started with these particular regulators and utilities. And I know Yuan, who was here on this call, has from SAWAS has also been such a phenomenal source of just guidance and input from day one. We're 4 minutes over time, but I just want to conclude by saying that personally, I have learned more in the last 2 years working with the regulators and utilities, and particularly with visionaries like, you know, Engineer Chris, Chola, Richard, Mubiche and several others who are not here on this meeting because they have the vision, they've had the courage to try and the conviction to stay the course. And we're incredibly grateful to be working with a set of leaders like this who are not just shaping services in their own countries, but are actually helping shape and inform how we talk about sanitation as a sector. So thank you all so very much for what you're doing and for taking out the time to be here. Thank you to all the participants who've taken time out to join us today. Thank you all. This has been fantastic. And feel free to reach out to us if you have questions. CWISEplanning.com is the website where you can access the tool. Feel free to log in and take a look at it. And if you're also interested to learn more about the service models themselves or the experiences or anything else that you picked up in today's conversation, we're always available to chat further. Thank you all very, very much for being here with us. Thank you.
Thank you.
Thank you. Thanks, Chola, Mubiche, Richard, Engineer Chris.
Bye.
Thank you.
Everyone.
Thank you. Had a wonderful discussion.
Thanks, everyone. Thank you.